Medical practice managers and clinicians, are your patient calls slipping through the cracks? I'm about to show you how this orthopedic practice used this unique answering service tool to manage both routine and urgent calls, but this can work for any specialty. I use the name Fix Your Bones Orthopedics as an example. For PerfectServe, we do more than just call routing. We can route your calls, but we are a physician scheduler and we're tied to a secure messaging platform. So it's based on a physician's schedule that should be receiving these messages, and a physician who's off call should not be. And so you can set this up for your patients and other people calling, so people are guided to know exactly what to do, what to push, and where to go. One of the things that our team will customize this however you want. So you call in, it's after hours, or it's on the weekend, or it's daytime, but the office is closed at that time. You have reached the on-call center for Fix Your Bones Orthopedics. The office is closed due to the weather conditions. The office is closed. The office is closed for the holiday. Now, there could be any number of reasons, and you can customize your greeting here and say, the office is closed and our hours are such and such, and you can say something like that. But if you're a physician or calling from the hospital or ER, press 1. For appointments, prescription refills, and all other non-urgent matters, press 2. If you are a patient with an urgent call that requires the attention of a physician, press 3. And so as you walk through, you'll see each one. So if it's the physician calling from a hospital or an ER, because maybe it's an ortho surgery, you got to see it's an emergency, this needs taken care of quickly, press 1. You can leave a detailed message with your first and last name, the hospital or ER you're calling from, the name of the patient's date of birth. You can leave all these details, and then it'll say the physician on call will return your call. Thank you. And then it routes to the actual on-call physician. This isn't going to wake up the person at 2 a.m. who's not on call. The on-call doctor should be receiving this. If the doctor's off call, they shouldn't be on the schedule getting this routed to them. And so our system mitigates that and makes sure that the right message is getting to the right person at the right time. The other option you had here is for other non-urgent matters. Our data is showing that 80% of calls that come into practices are non-urgent. If the caller is calling, they listen to that, they should be pressing 2. The physician on call is available for urgent calls only. For non-urgent matters such as scheduling or canceling appointments or routine prescription refills, please call our office during normal business hours. And our business hours are Monday through Thursday, 8:30 a.m. to 5:30 p.m. and Fridays, 8:30 a.m. to 5 p.m. Thank you. So it goes through that process, and then press 3 if you're a patient with an urgent matter. If your call is a life-threatening emergency, you can educate your patients on the calls. A lot of times patients will just wait and they'll just push urgent for everything. In this situation, you're helping them stop, think a little bit more and say, I think this isn't as urgent as I thought it was. And if it is life-threatening, hang up and dial 911 or go to the nearest hospital. The physicians at Fix Your Bones Orthopedics take call at Superb Hospital in the city. The other piece is, please note, prescription refills or canceling appointments are not done after hours. If your call is deemed not urgent, you may be charged for an after-hours call. So if this is a consult call, you can warn your patients and let them know, hey, you're going to be billed for this if you really think it's urgent. If your call is not urgent and can be handled by the office staff during business hours, press 1. And then you can actually leave your message and it will go to the right person. If this is an urgent matter and you need to speak to someone immediately, press 2. And so you have these other options here. Press 1, it goes back to the main menu option. So depending on the complexity of your practice or the simplicity of it, our team can customize this. We can customize the greetings, we can do all these things. In this flow, if it's an urgent matter, press 2, please leave a detailed message and the details of the emergency, a phone number. The on-call physician will return your call, thank you. And then it would route and alert the on-call physician with a secure text, which is HIPAA compliant. And so in that situation, if it was urgent, it would go to the on-call physician who's on call, not the off-call physician. If you have your physician scheduling set up ahead of time, it's going to take that into account so you're sending it to the right place at the right time. But if it's not urgent, leave the message. The office admin can handle it in the morning and get right back to you as soon as possible. Now, if it's an urgent message, you can also set up escalation protocols where after 15 minutes, or between 0 and 5 minutes, the system sends another secure message saying, hey, you got a message, it's urgent, you need to follow up with this patient. And then you can set up that protocol at 5-minute delays afterwards. You can set this up for OBGYN groups, for pediatrics, for neurology, cardiology, nephrology, urology, all of the specialties in healthcare. You can set up how you want your patients to hear and understand what to do. One way to handle this is to reroute a lot of these non-urgent calls so that way only these urgent messages are getting through and the right patients are getting the care they need. The critical patients are getting the care that they need in those moments. And this is one thing we can do to walk alongside you in your practice. When a patient calls in, do they actually know where to go, or are they left going beep, 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 and they're stuck not knowing where to go? If you have any questions, feel free to type in the comments or just go to PerfectServe.com and you can check out our resources there to help you out.